This Medical Minute, sponsored by Avera.
March kicks off Colon Cancer Awareness Month, and it is a good reminder for those turning 45 that it's probably time to schedule a colonoscopy.
Dr. Nicole Falls, a surgeon at Avera Marshall, discusses the importance of colon screenings and colon health in this Avera Medical Minute.
Well, Dr. Falls discussing colorectal cancer. How common is this exactly?
Well, it's the third most common cancer globally, and it's the third most common cause of cancer death at this time, following lung and then breast for females and prostate for males.
And are there some common warning signs when looking for colorectal cancer that we can keep an eye out for?
Yeah, sure. So if you're noticing any changes in your bowel habits, wherein they used to be firm before and now it's soft, or any changes in like the caliber of your stool, or particularly any changes in the color, and you're specifically looking for things like bright red stools or black stools.
When screening for this, are there some recommended guidelines in terms of when something maybe becomes more serious and might require a little bit more medical attention?
Yeah, so there are now general screening recommendations. They have lowered the age at which we should start getting our screening colonoscopies to age 45. And then depending on what they find on your colonoscopy will kind of determine when the next time you should get a colonoscopy is. And this is our gold standard for screening for colon cancer. And it can reduce up to 90% of colorectal cancers if done regularly. There are like less invasive options for screening for colorectal cancer, such as fecal stool tests or testing for like stool DNA to determine if you have like a gene carrying colorectal cancer. But the gold standard is a colonoscopy.
And perhaps not a ton of people just completely eager to do this, which is fair, but what do you tell people that perhaps are a little hesitant on completing this whole process and the prep for this?
Yeah, so again, yeah, the prep is not awesome. It's going to be the best nap of your life, though. This is the best way that we have that we're able to detect colon cancer. And when caught early, the colonoscopy is, besides being just a screening tool, is also diagnostic. So it allows us to treat any small polyps at that point in time to overall reduce your risk of getting colon cancer, having to avoid you having to get a larger surgery.
And any other final thoughts on this regarding whether how prevalent it is or how easy it is to simply make these preventative steps and then making the big difference in the future?
Yeah, the prevalence, it's really important to talk to your doctor about this because we are seeing an increase in prevalence, especially in the younger age group, which is why the age at which screening starts has been lowered from 50 to 45. It's going to vary, particularly if you have a positive family history of colorectal cancer. But really, if you notice any changes in your stool, regardless of when the last time was you had a colonoscopy, it's always good to talk to your healthcare provider if you should be getting one sooner than what was initially recommended.
Dr. Falls, thank you very much for your time today.
No problem. Thank you so much.
For more information on colonoscopies, head over to avera.org/medicalminute. We'll be right back.